Good afternoon, LeadingAge California members. This is Meredith Chalemi, your Director of Regulatory Affairs. Thank you so much for joining us for today's webinar. Today we are talking about the Data Exchange Forum, and this is our first webinar, specifically setting the stage for data exchange. If you would please put your name and your member organization in the chat, that way we can get to know each other and who is attending today. And it's my pleasure to also introduce you to today's speaker. I would like to introduce you to Denise Donato from Intrepid Ascent. She is waving to us. She's a senior consultant for community change. Denise is passionate about collaborating with community partners to leverage data, solve inefficiencies, and push towards transformative healthcare delivery. She has over 20 years experience in relationship management and has cemented her keen communication skills supported by diplomacy and tact when navigating complex business partnerships. She is highly skilled in community collaboration with varied stakeholder groups, including executive leaders at partnering organizations, community stakeholders, and technology vendors. Before joining Intrepid Ascent, Denise served nearly a decade as the Director of Community Service and then the Chief Engagement Officer for the Rochester RHIO, one of New York State's most successfully health information exchanges, HIEs, where she was responsible for executing the mission and vision. So you'll see that she's a perfect person to guide us on this journey as we trek towards the data exchange framework. And now I'd like to hand it over to you, Denise.
Thank you so much, Meredith. Two things are now true after listening to that bio. One, I feel really old. And two, it's surprising how long I've been in the world of healthcare. Time really does fly. I'm going to go ahead and advance to the next slide here. We'll talk with you all a little bit about the agenda today, and I'll introduce some colleagues that are here with me who will be interacting with us throughout the presentation. So you'll see first in that lower corner of the slide, there is an opportunity to participate in something called Poll Everywhere. So for those, I would suggest everybody, but for those interested, you can click on that link, and it's also going to be available in the chat. And we have a couple of different opportunities for you all to answer questions and test your knowledge of the data exchange framework. On this slide is really our high-level agenda. What are we trying to accomplish today? I'm going to comb through this slide and go to the next slide. You'll see my face, and you'll see our executive sponsor, Danny Carter. We're going to be presenting today, but we also have with us Rachel Goldberg. Rachel, just kind of wave your hand. Rachel is really the data exchange framework subject matter expert. So throughout today's session, for those of you who maybe ask a question in chat, you may see that your response comes right through from Rachel. Also, as we go along today, if we have a question from somebody who raises their hand, we'll all work together to make sure that we can address that question for you. In addition to that, we have Emily Horton. Emily is the one that's sort of driving the bus today. So you're going to see different things come from her in the chat. Some of the materials associated with today's webinar will come over via chat. So any links, we'll also make sure that they're available after today's session as well. All right, we'll go ahead to the next slide. So just to kind of set the stage about data exchange framework. So the overall intent of the data exchange framework is really kind of what it says, right? The idea is to break down these silos across the care continuum and really increase opportunities to share data. The goal has always been the same. It's one that's probably central to everybody's mission and vision. It's really about improved client care, increasing the opportunities for us to talk with one another and to provide information to one another in the best interest of the people that we serve. We know the reality behind this, and we'll kind of tee up the next slide. The reality behind this is that the data exchange framework is also probably in competition with some other priorities. We know the reality behind workforce, different funding struggles. All of these things are kind of competing priorities with the data exchange framework. But I want to kind of point out that quote at the top of this page. The idea, I think, behind the data exchange framework, and the reason that we're all spending some time with you today and will be over the course of the year, is to really provide a roadmap and a guide for the data exchange framework. We want to be able to answer as many questions that you all have as possible along the way. We want to be as informative as we can, and we want to be able to provide you tools and resources that are really going to help you along the way. So recognizing that we all have 90 million other things going on, the whole idea behind these sessions, these webinars, is to really kind of get rid of some of those myths around the data exchange framework, provide you with the information that you need in order to make decisions, and to really make the data exchange framework onboarding process as easy as possible. So we're going to go over today a few different aspects of the data exchange framework. We'll talk about the data sharing agreement. We'll also kind of touch on a little bit of the policies and procedures. We'll be spending some more time on policies and procedures in our next webinar. We'll talk a little bit about who is required to sign. Those are called required signatories. So we'll spend a little time teasing out required and non-required signatories and what that means, and the timeline associated with the data exchange. So go ahead into the next slide. And that is our first question, which is, how many of you have heard about the data exchange framework prior to today's session? Okay, about 50-50. All right. 50-50, 60-40. I love how these move as we go. Given that, we'll spend a little bit of time really kind of outlining what the data exchange framework is. For those that are more familiar with it, hopefully I won't bore you with the details. So we'll kind of touch on a little bit of the high-level framework. So if you want to go on to the next slide, I see folks are also answering in the chat. If for whatever reason that poll everywhere doesn't work for you, or if you're joining this webinar late, Emily has put in the link to the poll everywhere if you're interested in participating. So the first thing that we're going to sort of talk about is the why behind data exchange, right? So at the end of the day, we look at some of these different initiatives, whether they're state or federal initiatives, and we sometimes ask ourselves, why is this initiative come to be, and what is the implication it has for my organization? And I'm not going to read through everything on this slide, but I'm going to sort of acknowledge some of them, from a high level. It also, like I said earlier, talks a little bit about breaking down those silos. The end of the day, we know that the framework around information sharing is fragmented. And so prior to this state initiative, there really was a high level of variability around the data that was being shared, who was maybe using a health information exchange in what region, and the data contribution and participation in some of those regional hubs was really voluntary. And so the whole idea behind this framework is to really solidify and simplify, across the spectrum, a framework to kind of abide by, right? And so to create a structure where there wasn't structure previously. And I sort of want to acknowledge both the state and national because I think the second piece to the data exchange framework, and one that maybe, I don't know, I didn't initially think about right away when I think about data exchange, is to really think about all of the stakeholders that maybe are missing from data exchange today. And so for many of you, this is probably the first time that you may be really considering data exchange with other community partners at that electronic level, or maybe with a health information organization. We'll talk a little bit about qualified health information organizations further on in our conversation today. But I think that the other reality is that the data exchange framework is meant to address, those gaps in data sharing that exist today, right? Looking at some of the missing stakeholders, looking at community-based organizations, looking at behavioral health, skilled nursing facilities. We talk about home care and hospice. And so many of you all maybe haven't necessarily been to the same level of data contribution and also funding opportunities associated with that data exchange. So sort of acknowledging that as well. I think we have some supporting materials. We'll make sure that we share those links after the session today as well. So a little bit of, now that we've set the stage around the data exchange framework, I want to kind of talk a little bit about what it is and what it isn't. I think I'll start with what it isn't. It is not sort of a new technology, and it is not a centralized repository. What does that mean? It means that it's not a single solution. And I don't know, some people may say that that's a good thing. Some people may say that it's a bad thing. I would argue that the data exchange framework is our first opportunity to build an infrastructure maybe that wasn't there before, and to encourage a certain level of data contribution and data exchange maybe that wasn't there before. And I don't think you get there with maybe a new technology platform or some sort of centralized repository, similar to how we think about having a single best record, or like how we identify ourselves or legacy identify ourselves with a social security number. The reality is that there's a lot more to data exchange than just the technology aspect of a data exchange. Yes, we have a law now, the California law, and we have it here on the screen, AB 133, that sort of creates that requirement and that framework that we're talking about. And we also sort of acknowledge that it's about health and human service exchange and not just health exchange. We also have now a framework and policies and procedures that didn't necessarily exist before. And some of those are still being solidified today, but we have now a single data sharing agreement across the state. And we also have a set of policies and procedures that are really going to help govern that data exchange. I also want to acknowledge that part of the data exchange framework and some of the responsibilities that you all may have after signing a data sharing agreement is to abide by those policies and procedures, but also to generate your own policies and procedures as an organization. Those things that are important associated with data exchange, right? Do you have a breach reporting policy? Do you have mechanisms and different protocols attached to HIPAA compliance, maybe for your organization, if you're a HIPAA covered entity? If you're not, governed by HIPAA standards, there's going to be other, sort of requirements that are maybe going to be addressed a little bit further. We'll talk a little bit about required signatories and non-required signatories and why we have those kind of phased approach to the data sharing as it relates to those required signatories and non-required signatories. The other thing that is listed here, and it's that fourth checkbox, is the requirement around the data exchange framework is that you're exchanging data. It doesn't specify that that data is required to be exchanged through a health information organization, HIO, or a health information exchange, HIE. One of many things, sometimes they're called RIOs. But the long story short is that these hubs exist, and they will evolve, and they will go through a process to become a qualified, many of them will go through a process to become a qualified health information organization. The framework itself doesn't require you to use that as a vehicle to exchange data, or as a be-all, end-all technology or standard that you have to comply with. We'll talk more today, but also in our upcoming webinar series about QHIOs, what's the benefit of connecting and working with a QHIO, because there are several, but also acknowledging that each organization may have to make different decisions that are in the best interest of your organization, but are also central to how you need to exchange data with your other community partners. So it's not a one size fits all. There's clearly some benefits to using a hub, and we'll talk a little bit more about them, but it's not necessarily a requirement of the data exchange framework. Anybody having questions along the way, I encourage you to raise your hand or to enter your question in the chat. I'm going to kind of try and get through some of these, and then we'll have hopefully enough time for questions and answers at the end. All right, so who's required? I think that there is some question marks around required signatories and non-required signatories, required organization types and non-required organization types associated with the data exchange framework. So I want to talk about one date that's already occurred. So for those who maybe answered no when we asked you that first question about how familiar are you with the data exchange framework, there is an important date that you may have missed. If you are a required organization type or required signatory, we have an important date at the end of January where you were required under the law to sign that data sharing agreement. And so some of the questions that we may go over at the end of our session today is, I missed that deadline, what do I do? We also are sending through, and we should have available shortly for you all, a Q&A, and we'll continue to build those Q&As for you all as we move throughout the year. You know, one thing that's really great about your membership with LeadingAge California is that we're not only doing this webinar, but we'll have a whole host of other material that's going to be available to you as a LeadingAge California member. And so we'll talk a little bit more about those at the end of today's session, but I encourage you for questions, please continue to share them, and Meredith will work together on getting those questions so that we can continue to build out those FAQs so that they're meaningful to LeadingAge members. So required signatories, we have a couple of sort of organization types listed here. For those on the call today, we've highlighted in yellow, maybe some skilled nursing facilities. So for those of you who are a skilled nursing facility, you may have missed an important deadline, or you may not. There also is a list of all of the required signatories on, I think we have, is this link, I'm not sure if this link is to it, but we'll share that link as well. There's a registry of required signatories, and we're going to do our best as we work together throughout the year. We're going to do our best to kind of announce those who have already signed. So we'll do some shout outs as we go, and we'll try and sort of acknowledge those folks who are signing along the way. Some required signatories have until January 2026 to implement the data exchange framework. So, you know, some nuances here. What does that mean? So it means that there are some folks probably on this call today, there's a list of different stipulations. If you have less than 25 physicians, if you're a rehabilitation hospital, long-term, acute care hospital, acute psych, critical access, rural general acute hospital with less than 100 acute care beds, and some nonprofit clinics with less than 10 providers. What does that mean? It means that you maybe have a longer runway to implement the data exchange framework, but you all as a required signatory are still bound by that January 31st signing data sharing agreement. So kind of just to differentiate, all required signatories have that DSA signing requirement by January of 2023. And then for required signatories, there's sort of two different buckets. And the first bucket requires you to implement in 2024. And the second requires you to implement in 2026 if you fall under that category, which I've listed out. We'll share that with you all as well after today's session. All right, we'll go on to the next one, which is, can you name a required signatory? And I would say if you can do this by type, or if you want to, you have some colleagues and friends on the call today, please feel free to do some shout outs there. Yeah, skilled nursing facilities, that's a big one. Yeah, and that's another point too. And when we say implement the data exchange framework, what we mean by that is that we need to start sharing in a way that's defined by those policies and procedures. And we also need to create a policy and procedure framework within our own organization that supports that data exchange. Very cool. I love these word clouds. At the end of our session today, we're going to ask you to complete a survey. I always say if you don't do it, we'll do it for you. So please be candid with us and let us know your feedback about not only our content, but how interactive we can be today and in the future. All right, optional signatories. These are the organizations that have a little bit more of a runway in both the data sharing and in the implementation. So for those of you on today's call, and maybe also as you work with your business partners and maybe have referrals to and from home health and hospice, you know, just to kind of give you an idea around that data exchange framework and who maybe is going to be required to connect and contribute versus who is not required to connect and contribute in that first wave. It doesn't mean that they'll never be required to connect and contribute. It just means that there's more work to be done to solidify some of those requirements. Some of that has already been solidified around January 2026, and we'll share that information with you as well as part of our presentation and as part of our FAQs. I'll give you a for instance, because it's one that's sort of still kind of haunting at me. PACE, I don't know if there's anybody that's on the call. PACE, assisted living is another one where we're really trying to get some answers to questions. Am I required or am I not in that first wave of the required signatories? And we are working you know, with the state to get as much information as possible. And hopefully we'll be able to provide clarity maybe where there isn't. For those of you maybe who have participated in some of the state calls or who have gone out on the website, there's a whole host of different webinars that the state has kind of put together with their business partners, Manat and CDII. And some of those have some additional clarity, but as a part of being a member of LeadingAge California, we're going to work together to try and give you additional clarity where there isn't. We know that some of the responses is been to contact legal counsel. Obviously, there's a reason for that. We want to make sure that your organization is using your resources to make sure that you're compliant with the rules and the law that's come to be by the state. That's important. And that's probably why some of the responses have been vague. But we all are going to work together to try and do our best to give you clarity where there isn't. That doesn't mean that we'll always have the answer, but we'll continue to do our best to get you answers to some of those questions. All right, we'll go on to the next slide. I know this is a busy slide, but we wanted it here for those of you who are going to look at the deck after or who are going to take this back to your organization. We've highlighted a couple of key dates. January 31st, 2023, required to sign the data sharing agreement. So if you're one of those skilled nursing facilities, you're required to sign the data sharing agreement by January 2023 and required to implement by January of 2024. That means exchanging data and being compliant with those policies and procedures that govern that data sharing. We also know that when we take care of our folks, in skilled nursing and across the care continuum, home health, hospice, assisted living, that we're working with and we need to or want to exchange data with some folks who maybe are not required signatories. So since you all do work, with some of the non-required signatories, or you may have joined the call today, it's important to kind of know maybe where they're at as far as data sharing. So if you're starting to kind of work together with partners, that maybe you can build a plan that is going to make sense for you when you're thinking about sharing data electronically. Okay, we'll go on to the next slide here. When do required signatories need to sign the data sharing agreement? Okay, I like it. It works. All right, good. I'm glad we're clear on that. If we have questions or if you've missed that deadline, definitely we'll make ourselves available to answer any questions that you have. All right, I'm glad that there's no confusion. I want to do a little bit of a shout out, and Meredith will work together on doing some shout outs in our future webinars. But it's important to acknowledge that over 1,400, and it's probably even grown since when we put this slide together, but 1,400 organizations have already signed that data sharing agreement. And of those, 80 of them were long-term care facilities. So again, there's a web link here, but we'll make that available to folks who participated in today's session. It's going to give you a list of those signatories, and it's also going to give you a link to the data sharing agreement signing portal. So if anybody has any issues with going through that process, please let us know in the chat, and there we can give you some pretty easy instructions. We'll also continue to try and share some of the numbers with you all as we do our webinar series throughout the year. I always say two things drive me, and it's stories or data. So one thing that we're going to try to do with LeadingAge California is share some stories around the data exchange from community partners and other LeadingAge California members. And we'll share numbers as we go, so that, hopefully in one way or another, that the overall objective resonates with you. So data sharing through the data exchange framework. This slide here really kind of outlines, the types of ways data can be shared. So like I said before in that earlier slide with those check marks, you don't necessarily need to connect and contribute to a qualified health information organization in order to comply with the data exchange framework. But you do need to both exchange data and have policies and procedures which govern that data exchange. So some of you may connect to an HIE or an HIO already. That gets you halfway there. But in addition to that, you need to make sure that you have very specific policies and procedures, which we're going to talk more about in our next webinar. And those policies and procedures need to be there in addition to the active exchange of information. The other thing, third-party technology, sharing directly with other partners. So you may work with a hospital and need to have a point-to-point exchange of data electronically. You may also work with third-party apps. So there's a lot around electronic data sharing that's happening both at the state level, but also at the federal level. So we'll talk a little bit more about that in upcoming webinars as well. All right. Now we'll talk about the dollars and cents. I know this is riveting, but this is really where I want to spend a couple of minutes, and it's around funding opportunities. We all know that in addition to competing priorities, the reality is that sometimes exchanging data electronically is costly or has fees attached to it. And so I think one thing that's really great about the data exchange framework is that there are some funding opportunities associated with it. So the first bullet here shows you how much money over the course of the data exchange framework is being dispersed. There's going to be rounds of dispersing those dollars. The first 2 rounds are going to be only available to required signatories, right? Round 1 and round 2. And then round 3 will open to additional signatories, to additional organizations. So if you're one of those home health agencies or assisted living organizations, it's going to be round 3 that you're going to be able to look at those funding opportunities. The other important note here is that a signatory may only apply to one of the 2 signatory grants. So we'll talk a little bit about the 2 different grant opportunities, but as an organization, you can only apply to one of the DSA signatory grants. And you're also not eligible if you already meet all of the data exchange requirements. So if you're already connected and contributing to an HIO and you already have all of the policies and procedures that govern that data exchange, you may not be eligible for that additional funding. If you have questions about that, or if you're wondering if those policies and procedures you do have comply with the data exchange framework, we can share with you a link to the policies and procedures that exist today and talk a little bit more, like I said, about those in our next webinar. And we do have a question here about when can we look to apply for funding? So we'll go to the next slide here. I think some of the dates are still open and outstanding. Rachel, I don't know if you can respond to that question that Patrick just raised.
Yes, so that's a great question. We're still waiting for the official application to be posted for both of these grant opportunities. Likely they'll have information up on the Data Exchange Framework website, which I can add to the chat again, and then we'll be circulating the link to the actual application once it is up and running.
Thank you so much.
Really quickly, excuse me, in terms of timing, what we've heard is that more information should be coming soon. They're saying Q1 of 2023, which in theory means this month. We'll see if it actually comes out this month, but that's what we've heard. So keep your eyes open for it, and we will very much be sharing that information out as soon as we know more about it. And I say we, Intrepid, as well as Meredith.
And we'll try to continue to answer questions as we go. I want to just go to let's see here, the next slide. And I want to be able to differentiate a little bit between the two grants. So I kind of want to talk about that first one, that QHIO onboarding grant. So there's a couple of things that grant is intended to do. It's intended to offset any costs associated with connecting and contributing data to that QHIO, any onboarding fees, or maybe EHR fees associated with that onboarding activity, and any other additional costs associated with, developing that increased capability in order to exchange data. So you maybe have an EMR or an EHR or a care coordination platform, but you may need to make some additional changes or enhancements to that in order to exchange data. And so that QHIO onboarding grant is just like it states. It's really for costs associated with onboarding to a QHIO. The TA grant has additional permissible use of funding as well. So the TA grant is really to, identify and contract with a vendor. So maybe you guys are still on paper. And if you are, the TA grant is something that you might consider for working through a technology solution in order to meet the data sharing requirements. It may also be used to onboard, the cost associated with implementing a technology. Same kind of thing. You may have a technology, but it doesn't necessarily meet the level of capability to exchange data. And so you may have to make an enhancement or go through a new version, and there may be cost associated with that. And then last but not least, creating, training, and other things associated with implementing that new workflow. And remember, we talked a little bit about there being two aspects of the data exchange framework. It's the actual act of exchanging the data, but then also being able to create an infrastructure that supports that data exchange. So all of the different policies and procedures associated with those workflows and processes internally as an organization that you may need to comply with, that you may not have a mechanism to do that today. The next slide, and I won't spend too much time, but we wanted to share with you some of the actual dollar breakdowns that have been shared with us thus far. We'll continue to bring this information to you as quickly as possible. But this is a nice way of breaking down by organization type and looking at that in associating with funding that's available. And you'll see there's an asterisk there with the funding maximums. So this kind of lets you all know that at most, based on an organization, this is what you'd be eligible for. It doesn't mean that, each submission will grant you that total funding for each organization. And there will be a range of that by your submissions for these grants. And there'll be other factors at play. So for example, if maybe you've used grant funding in the past to do other things associated with data exchange, something like that may be looked at in your grant application. Or maybe you are serving traditionally underserved populations, maybe in a rural area, and the runway to get you to data exchange is maybe far greater than some other partners that you work with when you're doing referrals or exchanging information. So these are the types of things that will be addressed in each, I would say, maybe individualized grant application. Okay, considerations. So the next slide is going to outline a list of questions. And it's really meant to acknowledge the fact that we don't yet have all of the answers to some of the questions that we have that are going to impact LeadingAge California's members. And the reality is that not everything is set in stone, and some of the data exchange framework will continue to evolve as some of the policies and procedures get amended. There may be some legislative cleanup efforts to actually add clarity, maybe where there's confusion today. As these things happen, what we are going to try to do is make sure that we're backing them and that we're circling back with Meredith and team so that we can get you all answers to some of the questions that we might not have answers to today. And if you can go over to that next slide, these are some examples of that, right? So you may have asked this question already. Where are the sticks around required signatories? This is a good one, right? Where's the requirements? Where are the penalties? What are the penalties? What if I don't do something by this date? And some of the answers to that question are still unknown. What we do know is that the data exchange framework is a law. So that's something that we do know. And we do know that as it's stated in that law, required signatories had that data sharing agreement of January of 2023 to sign. So, maybe some of the compliance measures on the back end are yet to be solidified, but it doesn't necessarily mean that they won't be there eventually. If and when they are, and we know about them, we'll continue to share those with the folks at LeadingAge. But we don't necessarily have all of the answers around some of the penalties associated as of yet. Okay, why sign? So this is sort of what I was just talking about, right? It's the law, right? But outside of all of that, right? Outside of the check a box, comply with X, I kind of want to talk a little bit about some of the other things that you all are probably driven by on a more day-to-day basis. At the end of the day, exchanging data electronically helps build a more complete picture of a person and the people that we serve in the work that we do. It's going to impact, obviously, the quality of care. And the more we can do to open those pathways for increased data sharing and build an infrastructure that supports that data sharing, and one that's the same and creates sort of structure and a singular process where historically there hasn't been, is only going to further the quality of care in the communities that we serve. The other thing is that, the world of payment reform and managed care organizations and the work that they do around value-based payment is evolving. And so when we think about having access to data, in particular, as it relates to the patients that we serve, there's other metrics that help us, both with payer connectivity, but also with some of those quality metrics or those controls by HEDIS and other entities. So, it's one thing to be responsible for maybe a Medicare requirement, maybe something that's attached to your star rating, right? But it's another to have access to the data to sort of substantiate that rating. And so, has the person been readmitted to the emergency room 7 days after discharge from a skilled nursing facility? Maybe today you don't know the answer to that question. Thinking about electronic data sharing also helps you get some of the answers to those questions that really help you both from a quality of care perspective, but also a quality reporting aspect as well. And lastly, the reality is that right now there's funding available. And so as we think about the data exchange framework, we know that right now there's going to be grants available to augment some of the costs associated with that data exchange. Might that always be the case in the future? You know, who knows? But we know that right now there's funding available that we can capitalize on, you know, as it relates to getting this good work done. And again, it's the law. Okay, signing the data sharing agreement. I'm going to talk a little bit about what's here on the slide, but I might pick on Rachel a little bit. I want to talk about sort of the way that organizations are structured and how it works with signing the data sharing agreement. You may be a primary or a parent corporation, and you may have what they call subordinate entities. So you may be a parent corp, but maybe under that parent corp are several different skilled nursing facilities with different tax IDs. So there's different things that you are going to want to think about when we think about signing that data sharing agreement. You know, who is authorized to sign that data sharing agreement, having the right information for that person. You're going to need to have, you know, a little bit more information about the license number of the organization and how some of that structure works with the parent corp and subordinate entities maybe that fall under that organization. The way that it works with signing, and Rachel, correct me if I'm wrong here because this is an important sticking point. You can sign as a primary or parent corporation or primary entity. And you can also work within that structure to sign independently as a subordinate organization. Am I saying that right, Rachel?
Yeah, so it's that a parent organization can go in and sign and list out the subordinate organizations or facilities. You'll just need to have the independent license or employer identification number for each of those facilities. And so we just recommend that as an organization, you come up with a strategy for, are you going to have each facility sign separately? Are you going to have the parent organization sign on behalf of your subordinate entities? You can also go back in at a later date and add additional subordinate entities. And if you need to take any away, CDII can help with that as well.
So we may have questions about this one after the fact. I think, you know, when I think about signing the data sharing agreement, it just sounds really easy. You know, review what it is and make sure that you can comply and sign on the dotted line. But the reality is that the organization structure that you all have is going to be different and unique to your organization. And so really thinking about, like Rachel said, building a process around and having a conversation internally at the organization level about how you want to go ahead and sign that data sharing agreement. Okay. Resources and upcoming activities. Drum roll. The Data Exchange Framework website and the signing portal, these are links. We'll have these available to you after the fact. And then I'll also call your attention to LeadingAge California website. So you all are going to have a dedicated resource that's specific to LeadingAge California members. And that will also be where we post all of the different webinars and some of the other materials. We'll also put links on that website for the resources that we're calling out today, like the Data Exchange Framework website and signing portal, etc. So hopefully that will be your one-stop shop to getting access to all of those additional resources. And that will be live soon. Oh, all right. We've got it here in the link, hot off the presses. Meredith has shared that site, and we'll continue to load content to that site as we go. All right, what else do we have coming up? Webinars. So we're going to be hosting these webinars throughout the year. You will see a list of the different webinars and the webinar topics. That should be coming your way sometime in the next week or so, along with all of the dates for those webinars. The actual dates, not just the month. We've kind of given you an idea of some of the months that will be hosting the webinars, but we'll also be sharing the dates with you and a registration similarly to how you registered for today's event. We're going to send out a survey. It's a little bit more than a survey. It's a learner needs and HID adoption self-assessment. What does that mean? It's a lot of words. We're really trying to kind of have a conversation with all of you about where you are in the process of exchanging data and where you are in the process of looking at those policies and procedures. And in order to do that, we want to hear from each of the organizations about where you think your needs are, where you are today, and then also looking at both what it means from a human workforce and workflow perspective and from a technology perspective, because sometimes they're aligned and sometimes they're really different things. And in some cases, there's really, really, really different needs associated with each. We're going to have some fun with video clips. So we're going to put together some short video clips, and those will be coming your way soon. Sometime in March, I think, is our first one. FAQs, which I mentioned earlier. We'll do an implementation and adoption assessment in the middle of the year, kind of see how far we've come and where we are. We'll also be hosting a mid-year working session. We'll have coaching hours. I think we have a few other activities associated with engagement as well. So more fun to come, hopefully throughout the year. We have a question for you. If you think your organization is going to sign the data sharing agreement within the next month. Yes, no, maybe so. Wow, I love it. Wonderful. Thank you so much for that. That's great to hear. If you have any questions as you're going through the process, Meredith and the team here will make themselves available to answer your questions as best we can. That's really great. Oh, we've gone down from 100%. Emily, we should have switched off this slide right away once we were at 100%. We have some time for questions. I'm gonna, two things. We have our survey baked right in to the presentation today. So if you could take a little bit of time, like I said, let us know what you thought about today's session, good, bad, or otherwise. Like I said, if you don't fill it out, we'll fill it out for you. We use your feedback to help create our next webinar and make improvements and adjustments along the way. So please definitely share that feedback with us. Okay, I don't know if we've got questions here. Maybe we wanna, maybe if somebody has a question, maybe raise your hand.
And we have a question right now from Al Grimm. How does this relate to the Connected Care Center that we have implemented in our EHR already?
So Al, maybe if you don't mind, could you come off of mute and talk to us a little bit about your Connected Care Center? Maybe Al can't come off of mute.
Al is unmuted now.
Okay.
I'm unmuted.
We hear you.
Okay, yeah, we have Point-Click Care as our electronic health record, and we recently implemented the Connected Care Center that is a feature of Point-Click Care that allows us to give access to resident health information if they approve it to their family members, so that they can log into Point-Click Care through a portal that was created to be able to see the local information about their particular resident.
So it certainly sounds like it addresses maybe one aspect of data exchange. I don't know if that gets you all the way past the goalpost. I think there'll probably be some additional questions that we would have for you, Al, and we can certainly talk a little bit about that offline. I think the other thing that we want to kind of think about is not just what the technology is around the exchange, but all of the other supporting policies and procedures associated with it. So the hard part is I don't have an answer for you with a yes or no today. And I know that's awful to say, but I think we could have seriously a one-on-one conversation and learn a little bit more about the Connected Care Center. And then also kind of talk through, and we'll share with you about maybe a link to some of the policies and procedures. That's really, Al, probably where you're going to want to spend some time making sure that your organization can comply with those policies and procedures. And then in addition to that, we'd want to tease out some of the technology associated with that Connected Care Center.
Yeah, it was in response to the CARES Act.
Yes. So absolutely understandable. I think that information sharing both at a clinical with other care providers, but also with patients who request their data, I think is probably where you're getting at with that. I don't know if just that gets you, like I said, past the goalpost.
Right.
But we could certainly talk more about it. Rachel, I saw you're coming off of mute too.
Yeah, I'll just jump in. So with any EHR technology, not just point-click care, they can decide if they want to try and become a QHIO or Qualified Health Information Organization. If they apply and if they're approved, that basically means they have a seal of approval from the state that they're meeting the kind of the more technical side of the requirements. So the transaction patterns, data elements to be exchanged, those aspects of the framework. So that's one consideration, is if they are applying and if they're approved. If they don't apply to become a QHIO, it just is a little bit more of a burden to then, as Denise was mentioning, kind of check in with the DSA and PNPs and then do a little bit of due diligence. So does your EHR meet these, can it do these transaction patterns? Does it exchange these data elements? And then alongside that, what Denise was saying, that goes beyond the technology. So do you have the appropriate privacy and security training set up, for example? Are you sending the right data into your EHR? So it's sort of twofold. One, does your technology do what's necessary? And then two, do you have the organizational policies set up to also support what's required in the data exchange framework?
Thank you.
Other questions?
I was going to say, I think we have time for one more question. If anyone has a burning question, please ask it or chat it. Thank you everyone for filling out your feedback surveys on the webinar.
As you can see, the answer to your question, my favorite color, it's green. Looks like we don't have any additional questions. I'll wrap by saying thank you first to everybody who participated in today's session. We really appreciate it. This deck also includes an appendix, and that appendix has some more granular content. So we'll be sharing that with you as well as what we covered in today's discussion. And so if there's any questions that come to be after the fact, we'll work together with Meredith and team to get those answers to you. Thank you again. Bye-bye, everybody.